Oh!
People are doing Ozempic parties here in LA.
Everybody's using it for weight loss.
Rumors that Kim Kardashian was using it were rampant.
Didn't fit me. And so I looked at them and I said, give me like 3 weeks.
Ozempic and Wegovy have been a rage lately thanks to celebrities endorsing it lock, stock and barrel. Elon Musk, Khloe Kardashian seem to be very happy with Ozempic and the other medications from this group. But what is the reality? I hope by the end of this video that I have answered most of your doubts and questions. But first, Ozempic and Wegovy are both brand names for the drug Semaglutide. Semaglutide is a GLP-1 agonist which is used to treat diabetes and has found significant benefits in weight loss. It is sold under the brand names Ozempic, which is an injectable form, Rybelsus, which is our tablet forms, and Wegovy, which is specially formulated as a higher dose for weight loss. First off, if you are diabetic, this video is not for you. Please work with your doctor at all times. Also feel free to switch off if you are already lean and want to solve your body dysmorphic fetishes. If you are lean and using this drug, consider not getting uncomfortably lean in the first place. Please. This video is for those who are obese and would like to take action over their health. Does Semaglutide work? Hell yeah, it does and works very well. In this video, I'm going to go over some of the pros and cons and if Semaglutide is a good fit for you. Semaglutide is one of the newer GLP-1 receptor agonist drugs. The role of GLP-1 agonists are to inhibit the secretion of glucagon and to stimulate the secretion of insulin, thereby reducing blood sugar levels in response to meals. This is why it is used in the treatment of diabetes. It was later found that people on treatment with this group of drugs showed significant amounts of weight loss. Along with blood sugar control, semaglutides also reduce the rate of gastric emptying, which results in you being satiated for longer. Basically, it acts like an appetite suppressant, and a very potent one at that. In trials with Wegovy, which is semaglutide at 2.4 mg, it was found that individuals lost about 15% of their body weight over the course of an year. Sounds great, right? But I feel that you should know about the cons as well before you take the deep dive. Semaglutide is a fit for you if you are obese with a BMI of over 30 for a male and over 35 for a female, and you have either one of the following conditions: hypertension, diabetes, and hypercholesterolemia. However, there are several reasons why you might discontinue the drug. One of the most common side effects of this drug is gastrointestinal distress. These include nausea, vomiting, diarrhea, constipation, and GERD. These symptoms were noted in almost 10% of diabetic patients. In obese individuals, expect these symptoms to be even more prevalent, as you might already be suffering from these, especially GERD. People previously suffering from GERD have reported serious discomfort with sulfur-like smelling burps. This medication is effective in long-term use, although the results have been seen in as little as 4 weeks. The oral form of the drug can be used off-label, but is not as effective. So it leaves you with only the injectable form, which is given subcutaneously, most commonly on the thigh. Although these injections come in a pre-dosed form in a pen, one might need to consider if you are comfortable with weekly injections. Another important reason you might discontinue this medication is simple: availability and costs. It is not available in most countries. For example, I found that in India, it is available only in oral form for the treatment of diabetes. At the same time, the costs globally are very expensive. You might have to consider if you can afford this drug for use in the long term. We most probably will not be able to claim insurance as well, as most companies do not treat obesity as a disease. You would be lucky to get it partly covered, which leaves us with the final consideration with this medication. As we had discussed, semaglutide helps with weight loss through appetite suppression. It has been observed that once you stop the medication, your appetite comes back with a vengeance, and 90% of people end up regaining their weight. You will need to make a commitment to eat healthy for this medicine to work. The medicine can only aid in you creating a caloric deficit. In medical interventions to the treatment of obesity, lifestyle modifications are always the first step, followed by medicines such as Wegovy and bariatric surgery as a last resort. I'd personally advise you to start with something easy, like eating healthier and moving more. Do this consistently over time, and if it does not work for you, then look to hop onto these medications to help you make those changes. If you'd like some help in creating a lifestyle change in a few easy steps, check this video next. Like, subscribe if this video helped you. Signing out, Dr. Rohan Fonseca.